Hi, my name is Danny Tan. I'm the dentist here at Clinica de Salud from North Main Clinic, and I've been the dentist here in Salinas area for over 32 years. And I want to talk about oral cancer. We as the dentists are the frontline providers in seeing these oral cancers because we spend a lot of time looking in the mouth and doing examination and working in the mouth. And there's several risk factors when it comes to oral cancers. One is smoking. If you are a heavy smoker, after years and years, you increase the risk of having cancer somewhere in your mouth, the lips, or even the neck area. Another risk factor is the alcohol. If you are a heavy drinker, the alcohol that pools around the inside of your mouth can damage the DNA makeup of the cells, and that result in oral cancer. And a recent one is what they call the HPV virus, which is the human papilloma virus. It's the virus that's primarily causes cervical cancers in women, and we see an increase in this, especially in the younger generation under 40 years old. It's due to having multiple sex partner or oral sex can increase the oral cancer. And then we have also your diet is one of them. And if you eat a lot of meat, proteins, and very low on fruits and vegetables, that can cause an increase in your oral cancer. And also, if you wear dentures or any partial dentures, dental appliance, if it doesn't fit properly, it can cause a chronic irritation to your gum tissues, and that can cause oral cancer. So there's a lot of risk factors, and this cancer is really rare, but it's very aggressive if you do get it. You know, there's a lot of things that you can do to prevent it. Don't smoke, don't drink, and get your HPV vaccine, eat a healthy diet and exercise, and you'll be okay. And also, most importantly, 6 months recall with your dentist. And today I'm going to demonstrate what we do here at the clinic as a dentist. When we see new patients and when we see patients every 6 months, we do a little oral cancer screening. We have here Liz, is one of our dental assistants from North Main, and she's happy to volunteer as a patient. And this is what we do normally with new patients, recall patients, patients that we see every 6 months. I'm going to show you, first thing we need to do when we do oral cancer screening is we look at the patient's face, make sure everything's all symmetry and nothing like a bump or lesions that are sticking out. And then we want to palpate the area right here. This is where her lymph nodes are, and you want to check for any swelling on the lymph nodes. But you also want to check if the patient recently had a cold, or because these can swell up if they had a cold or sore throat. So you want to make sure that's clear. And then you want to check in the area underneath the jaw for any swellings of the lymphatic. And then you want to, next you check on the TMJ joint, the joints here, and you have the patient to open wide. Go ahead and open wide as you can. And you want to feel that joint, make sure nothing is asymmetry, is clicking, or any noises that it makes. And then after that, we look at the outside lip, make sure it's nice and not dry or chapped. That can be caused if she spent a lot of time out in the sun. It can cause dry mouth here. So you want to make sure. And then we go in the inside of her mouth. In the beginning, you want to check, it's the cheek. Start palpating and feeling if there's any bumps or scratches or any red lesions. And if everything looks normal, and everything should be no redness or anything like that. And then you want to check the tongue and have the patient stick her tongue out, and you want to grab it with a little gauze, and you want to pull this to the side. This is what we call the lateral border of the tongue. This is the common area where oral cancer can first surface, right around here. And then you look at the other side. You want to see like a white streak or any red soreness there. And then we look at the back of the throat, say and those are the oral pharynx area. And then you look at the uvula, make sure everything just looks symmetry. There's no bumps, no scratch, or any bleeding in that area. And next you want to look at the roof of the mouth. Make sure there's no, again, bumps, scratches, or anything that doesn't look normal. And then you have the patient touch the roof of her mouth with her tongue. So you want to feel the floor of the mouth. This is the area where most cancer can occur, right in the floor of the mouth here. And then you look at, bite down, and then you look at the gums right here. Make sure everything looks nice and pink and not red. Okay, open wide. And then when you look at the back of the mouth, you want to look at the area where the soft palate, which is right around here, where the beginning and the hard palate. That's the area, the junction where a lot of oral lesions of cancer can occur. And bite down for me. And everything looks good. And that's it. It only takes 2 minutes. And I encourage you, everybody, to see your dentist every 6 months, at least for a checkup for your cleaning and your cavities and oral cancer. It's very important how your mouth is, the health of your mouth, because the bacteria that's in your mouth is also found in heart disease, Alzheimer's disease. Those are the same bacteria that can cause those type of systemic diseases in your body, all result from the mouth.